Hello, my name is Jade. I'm one of the nurse practitioners in physical health working for West London NHS Trust. I'm going to be talking to you in this short video on how to practice religious fasting safely living with type 2 diabetes. Ramadan is a very special time of year within the Muslim community. The Quran requires fasting from sunrise to sunset during this time. The time of Ramadan will change from year to year depending on the sighting of the moon. There are exemptions during Ramadan for those who may not be able to fast. These include children, the elderly, illness, physical or mental, pregnancy or breastfeeding, menstruating, and travelling. Type 2 diabetes is a long-term condition where your body does not produce enough insulin to regulate your blood glucose level. If you have diabetes, you may be at risk of having low blood glucose levels, known as hypoglycemia, hypo for short, and dehydration when fasting. At around 8 hours after your last meal, your body will start to use energy stores within our body to maintain our blood glucose levels. For most people, this is not harmful. There are many different types of medications that can be used to treat type 2 diabetes. Medications such as sulfonylureas, SGLT2 inhibitors, or insulin can cause harm whilst fasting. If you think you may be taking one of these medications or would like to talk about your medications during Ramadan, it is important you talk to your doctor or nurse for advice. Eating lots of foods that are high in fat and carbohydrates will have an impact on your blood glucose and weight. It is advised to eat carbohydrates such as rice, potatoes, chapatis, and samosas in moderation. Be mindful of foods that are deep fried and very sweet. There are many foods that can be beneficial to maintain blood glucose control. These include vegetables, meats, beans, pulses, lentils, and paneer. It is essential to keep hydrated during Ramadan. Fasting for long periods of time can cause dehydration. When breaking your fast, during your meal and before sunrise, you should drink plenty of water or sugar-free fluids. Avoid drinking sugary drinks. This will impact your blood glucose levels and can make you more thirsty. Aim to drink 2 litres of water daily. It is essential to check your blood glucose levels regularly. This will ensure it is safe for you to fast. If your blood glucose levels are high or low, you must treat this with the correct treatment. You should not fast at this time. Checking your blood glucose levels does not break your fast. If you find that you have a low blood glucose level, this must be treated immediately. A low blood glucose is below 4. If you are having a low blood glucose level, you may experience sweating, shaking, feeling disorientated, feeling tired, headaches, feeling hungry, or a fast heart rate. This is not an exclusive list, and everyone can experience a low blood glucose differently. If you think you are having a low blood glucose level, follow these steps. First, check your blood glucose level, ensure it is less than 4. Break your fast, then take some fast-acting glucose such as 200 ml of orange juice or apple juice, 5 jelly babies, or 5 glucose tablets. Then recheck your blood glucose after 10-15 minutes. If your blood glucose is still less than 4, take more fast-acting glucose. Then recheck your blood glucose again after 10 to 15 minutes to ensure it is above 4, and eat a small amount of carbohydrate such as a slice of toast or a packet of crisps. A high blood glucose level is above 12. If your blood glucose level is high, you may experience feeling thirsty, pass urine more frequently, headaches, and feeling tired. If you have a blood glucose level greater than 17, break your fast, drink plenty of water, continue to check your blood glucose levels. If your blood glucose level continues to remain high, speak to your doctor or nurse for further support. Do not stop taking your medications during Ramadan. Tarawih is a prolonged prayer, which can be a tiring activity during Ramadan. If you wish to participate in Tarawih, make sure to eat beforehand, drink plenty of water, check your blood glucose, and have some glucose treatment with you. We are here to support you. Reach out to staff if you would like support and advice around Ramadan. Here are some more resources to support you during Ramadan. By scanning the QR codes below, will take you to the British Muslim Council and Diabetes UK. Diabetes UK also have resources in different languages. Thank you for listening. Ramadan Mubarak.